We finished the another toughest cases, which is if Saudi is our angulation problem. New hyperdents we finally milled. So unfortunately we milled with an engaging, but now it's made engaging. How's the color?
The teeth are perfect, yeah.
Alright, so I'm going to change this color, no problem. So we're going to do it. So we're going to take it out.
Okay.
So I'm going to put the composite here, so we cure, and then make it bulk out. Or maybe put some acrylic over there. So ask them, so you need more bulk, how much more? Just 1 millimeter or 2 millimeter?
No, she's content with the aesthetics of this one.
I'm talking about, inside.
Inside.
Just a little bit more foam.
Yeah, maybe about 1 millimeter, 2 millimeters.
Just millimeter?
Between 1 and 2, yeah.
And then remember, whenever I made the pink is out, I have to make teeth slightly out to follow through, all connected. It's not separate. To me, the PMMA is a little flat.
Yeah.
So I'm going to make looks like hydro contour.
Okay.
So make more supporting compared to the tissue. Hydro contour, tissue contour, so slightly out. Slightly. It's bulky. But from the here, and then I can make slightly out, so you incorporate it.
Sounds good.
Good. So we're going to take it out. You already thick, but here's the under contour. So what I'm going to do, I add here, like you said, 1 millimeter, and also here, I can add a little bit more.
Okay.
Make sense to you?
Yeah, yeah.
Then I can maintain the midline, and then maintain the shape.
Yeah.
I think just a little bit longer, I could tweak a little bit.
Okay.
And then we try.
Yeah, yeah.
Sounds
She
good?
likes the shape. The midline is good. The
Cool.
incisal edge is good.
So I have to use the prime. If I go to, this is what exactly what I'm talking about. You see it on the contour, so I have to add more the facial thickness. This is one of the example. You see it under, so I have to add. Like here. So will be change the facial thickness compared to this. I'm trying to make a little bit thin here. I don't have to go. I want to make thick. Composite material is a little bit overhanging. So this is my kit. So I use this or this, a little bit more thicker. You can use this. Yeah, this is more lighter, which is great for composite. And ceramic as well. So what I do, and then, you know what? I like this. Okay. Here's a very tiny one. So I can do this. In between tools. This one only for embrasure. This is temporary. Well, the best way you can put it in the design. You don't have to do composite, it's like me. Put it in the design, then you can reprint it. It's much faster. This one is patient just came here, so I would like to see the markup. Okay, so what it look like? I put the composite, but it's not necessary. You see the added, okay. So now I steam it. Excuse me. And then try the mouth. Okay. This is preliminary cases. I'm trying to cut it here a little bit more flat. Alright, so if I have to do, I have to make it a little bit more detailed, which is not a problem. And the only thing is time consuming. But I'm not going to put too much my effort and just a little bit, then I can try in the patient's mouth, then we could discuss a little bit more further. I don't have to make the perfect formations. Just a little bit here. So I like the ears. I don't have to make really good contour, but shape is good. Just make more thicker. After she's satisfied, we can add here more, but I don't have to do right now. Alright, let's try the patient's mouth after the steaming. Have her more comfortable and a little bit relaxed.
Okay.
Like, no, relax. Relax. So tell her we add it. What do you think? Here.
We want her.
I add more than 1 millimeter.
Okay.
Here, a little bit more foam, which is a very good choice because it protects the wrinkle. You know what I mean? If it's under and that area there's more wrinkle. So I'm going to write it down about the design of the tooth.
Okay.
Okay. So maybe I can ask her what, we can change her shape. Maybe almost, 45 degrees. And then I can see when she smiles.
Right.
Then I can see inside her position.
Yeah.
And then maybe inside her change here and there.
Right.
And we can do that. Make sense? Okay. So what I'm going to do, Dr. Haji, we're going to take it out one more time. And then I'm going to using my shade guy to pick the color. Okay. Pink tissue color. And then he will going to put in there. And then I'm going to check another teeth color. Okay. And then write it down. And then I can write it down about the contouring. So, this is very white. No, right? Okay. This? No. Right here. Okay.
Yo creo que va a ser como el que tenga abajo para que no se vea tan.
Oh, like this? Okay. Usually we follow the lower, but brighter than lower.
Right.
Not exactly, because she's not going to like it. If I make that color, see? Here. So I make a little bit lighter, possible this.
Para que no
this
vaya
is
a
okay,
ser
right?
igual, porque no le va a gustar. Este es igual que el de
I
abajo.
would go lighter. I agree with you. Yeah, lighter's better. I'd even like lighter than this.
Sure,
Yeah.
no problem. That's what I thought too.
Yeah.
And then I can go this, lighter. See?
Okay. Yeah, this I think is good. Yeah.
Or I can show you this one. I like this color.
Yeah, I agree. That's nice.
You know what I mean?
Yeah, very
Brighter than
natural.
this one.
Yeah, it's a little translucent.
Oh yeah.
Yeah. That's a good color.
Good?
Yeah.
All right.
Why is one?
Now we're talking about shape and contour.
O sea, como que se ve aquí.
Yeah. Straight? Sure, saw that. And then this lateral is a little bit longer, so I'm going to make
Está muy
shorter.
corto, este está muy short.
We'll make the good symmetry. No problem. Okay? Now is not much symmetry because I have to hurry up. So we're going to finish this very good symmetry. So we're going to match just a little bit pointing here. I'm going to straight. Straight. Make little down. Shorter. What about point? She doesn't like it. So we're trying to match it. Which one do she like it? This or this?
Este.
That one. Pointed.
Este lado.
Pointed.
Ajá.
Okay. Can you tell her to excursion? Can I rise? Down. Gently.
See, más,
Slow.
Despacito.
Slow. Wow. Okay. The other side.
Ahora para el otro lado.
I see. Okay. That's cool. How's the color?
Está bonito.
No, she likes the color.
They were a little bit darker than this.
That's why I was thinking whiter a little bit.
So you choose this. This is darker than this. So we can go this.
Yeah, that's beautiful.
It's up to her.
She wants to match what she has right now.
Nos quedamos con el.
This?
Mira,
Yes.
ni este ni
Okay,
este.
so now I change
¿Por
it.
qué no me quedo con este?
Before, I choose this. She choose this. Now I have to make this. Okay.
Está bien.
It's like that. It's more like that.
Yeah.
I like it.
Sí.
So good. Okay.
I think we can go to fine.
Yeah. So you can take it out.
Okay.
So we can scan it.
Okay.
That one. And then we can give you back so she can wear it.
Okay.
Alright, so see the patients, we made the composite on side, trying to cut it back 2 mm for Syton 7-star cases. And here's what we did. Now we're trying to make the frame design. Actually, we scanned that one, so we merge it together. And the patient wear the PMMA. And now we finalize it, the frame design to 7 stars, lip support here. Okay. So we have to cut it. More here, in here, in here, yes, like that. Yep, and now we need this. Yep. That's why we make the Syton 7-star as the benefit, because we have to extend the facial and linger we have to bring it in as much as possible. I finished the another toughest cases, which is if Saudi is our angulation problem. New hyperdents we finally milled. So unfortunately we milled with engaging, but now it's made engaging to make better. So I do have a little bit issue with the screw channel access hole, but now we fix it. So print the model. The patient was here. Then we're going to using the Syton 7-star cases, 3 unit bridge, 3 unit, single restorations, and 2 we're going to using the 2 piece of the ceramic. Okay. And then make the another crown here, crown there. So I have to bring more down those area than usual. Then we have a proper room and contour that I can finish is better. Alright, this is frame design. It's like click. Amazing cases coming up from the PMMA. Well, here's his access hole. Technically we slipped that implant, but the doctor will going to put the temporary cement with the crowns is top of the diaper screw in. Okay, so there's no screw for canines, but we have a 1, 2, 3, 4, 5 implants. Actually, technically 3 implants is working with the extra thin than with the finers work.